Encouraging the people in your care who can walk to do so several times a day has many important health benefits, even if the person only goes a short distance at a time. Some people will only need your assistance to remain safe and steady on their feet while they are walking. Others, however, will use an assistive device, such as a cane, a walker, or crutches to walk. Dizziness is common when a person sits up after being in bed for a while. It may have happened to you. Before assisting a person to walk, allow the person to sit on the edge of the bed for several minutes before standing up. If the dizziness does not pass after several minutes, help the person to lie back down and report the dizziness to the nurse. This is known as orthostatic hypotension. Another scenario, this person may also become dizzy after the person has been walking for a while. If this occurs, or if the person becomes sweaty, short of breath, or complains of pain, help the person to sit down and rest. Some people may begin to fall quite suddenly while they are walking, especially if they are weak, ill, or unsteady on their feet. Do not try to stop a fall. I'll repeat that. Do not try to stop a fall. Doing so may injure you and the person. Instead, use this technique to minimize injury when a person starts to fall. The first thing you do is put your arms around the person's waist or under the person's arms and hug the person's torso close to your body. Next, you place one foot behind the other to widen your base of support. Next, bend your knees and lower the person slowly to the floor by sliding the person down your leg. And finally, lower yourself to the floor and sit beside the person. Call for help, and while waiting for the help to arrive, stay with the person. Provide reassurance and make sure the person is comfortable. So let's talk about the types of assistant devices people use for walking. The first one we're going to talk about is a pickup walker. And walkers in generally are used by a person who can bear weight but really kind of just needs some support on both sides. You need to ensure proper fit, that the top of the walker frame should be even with the person's hip bones. And the guidelines for proper use for walkers in general are to make sure the walker is directly in front of the person, make sure the person places their hands on the walker's hand grips, stands erect, always stands erect, and slightly flexes the elbows. Now this is a pickup walker. Have the person lift the walker and put it down about 6 inches forward and then step or hop into it. Encourage the person to walk normally, looking ahead while using the walker. The next type of device we'll talk about is a four-wheeled or a semi-wheeled walker. And it has all the characteristics as far as who uses it and how to ensure proper fit as general walkers do. The difference with the four-wheeled or a semi-wheeled walker is you have the person roll the walker forward just about 6 inches and then step into it. The next device we're going to talk about are canes. And a person who needs assistance with balance and is able to walk without much difficulty can use a cane. To ensure proper fit, the top of the cane should be even with the person's hip bone. Follow the guidelines for proper use, which include make sure the person holds the cane handle with the hand opposite of the weak leg and stands erect with the elbow slightly flexed. Position yourself on the person's weaker side. Have the person move the cane forward about 6 to 11 inches. Make sure the tip of the cane is firmly on the floor. Have the person use the cane for support while standing on the stronger side and moving the weaker leg forward until it's even with the cane. Next, the person moves the stronger leg forward ahead of the cane and then the weaker leg. Always encourage the person to look ahead while using the cane. Our next assistive device is crutches, and a person who cannot use one leg or when both legs are weak can use support of crutches. Ensuring proper fit of crutches is done by making sure that the top of the crutches should rest against the person's sides, not in their armpits. And using proper guidelines include making sure the person stands erect, supporting weight on the hand grips, and gripping the crutches between the chest and the inside of the upper arms. Have the person move both crutches forward along the weaker leg and then bring the strong leg up to meet the crutches. Again, always encourage the person to look ahead while using crutches. Stay tuned.